Hello, my name is Jessica Hanley and I'm a senior athletic training student at Florida Gulf Coast University. Today I will be demonstrating how to conduct a cranial nerve assessment and begin by starting with one, which is the olfactory nerve. It has to do with the sense of smell. So to test our athlete, you can use something such as an alcohol prep pad, which has a very strong, distinct smell, and I'll hold it underneath his nose. Can you smell that?
Yep.
Yep. If he could not smell it, it could indicate that he has damage or some other type of thing affecting his cranial nerve 1, which is the olfactory nerve. Moving on to number 2, which is optic. This has to do with vision. So I can have my athlete read anything. So looking at this, it says alcohol prep pad. I'm going to have him look at this, and can you read that?
Alcohol prep pad.
Awesome. If he had trouble reading it, it could just indicate that he has, again, damage or some other problem with his second ocular nerve, cranial nerve. For the third, which is the ocular motor, this has to do with eye movement and papillary reaction. So you can test it a couple different ways, just eye motion in general, tracking, as well as the shining a light into the eye to dilate the pupils. So we're going to begin by doing that. I'm going to cover one eye and track in, out, the same thing with the other side, out, and they correctly and evenly dilated, so that is an indication that he has a healthy cranial nerve 3 ocular motor. Moving on to 4, which is straight eye movement, it talks about the ability to depress and adduct the eye. So for this one, we are going to just have him track my finger and make sure his eyes don't jump at all, just up and down, up and down, and they seem even and able to track correctly, so that's a good sign. If they weren't able to, were uneven, or jumped, then that could be an indication that that nerve is damaged. Moving on to number 5, which is the trigeminal nerve. It has to do with face sensation and mastication, the masseter muscle, forgive me. So for this, I'm going to have you clench your jaw like you're chewing gum, and you can feel that it's working correctly and is strong, and he's able to clench his jaw, as well as sensation, facial sensation. So I could touch the sides of his face and make sure that he can feel it. Can you feel it?
Yep.
Awesome. So that's a positive thing. If he was not able to feel it, or his jaw was unable, like he didn't have strength in his jaw, that's a sign that that nerve is damaged. So there you go. Moving on to number 6, which is abducens. This is another eye movement cranial nerve. So for this one, instead of going up and down, this one is more the ability to adduct the eye past midline, so it's side to side. So I'm going to have you follow my eye out, finger out, and the other side. Awesome. So that is, and if he was unable to do that, if one eye was off track or jumped, that could be a sign that that nerve was damaged. Moving on to number 7, which is the facial nerve. This is facial muscles and taste. So for any of the muscles of the face, I could have you smile for me, frown, or raise your eyebrows, for example. If any of these things he was unable to do, it could indicate that he had damage to the facial nerve, which is number 7, as well as sense of taste. If he was unable to taste something, then that could also indicate that it's damaged. The 8th facial nerve, which is the vestibulocochlear nerve, this has to do with hearing and balance. So I'm going to have you close your eyes for me and go on either side. Can you hear that?
Yep.
Can you hear that?
Yep.
Awesome. And another way to test it is to have him stand up and test his balance, so close his eyes and stand on one foot. If he's unable to do either of these things and shows that he's very deficient, that could indicate that nerve is damaged. Number 9 is the glossopharyngeal nerve. So this has to do with swallowing and like your gag reflex, as well as voice. So I'm going to have you go ah for me. Awesome. So if he was unable to do this or had trouble swallowing, it could indicate that he had damaged his glossopharyngeal nerve. So same thing, very similar with cranial nerve number 10, which is the vagus nerve, which also has to do with swallowing, voice, and gag reflex. So could you swallow for me? Awesome. If he was unable to do that, struggled with it, if the muscles just weren't working correctly to make that happen, it could indicate that he had damaged that nerve. So number 11 is the spinal accessory nerve, and this one has to do with your trap muscles and shoulders. So I'm going to have you shrug for me. Awesome. Could you put your head side to side? Awesome. So if he was unable to do this, had weakness or pain or something else, like he could have damage to the 11th facial nerve. Moving on to 12, and the last one is the hypoglossal. This has to do with tongue movement. So I'm going to have you stick your tongue out for me. Move it up and down, side to side. Thank you. If he was unable to do this, then it could indicate that he had damage to his 12th facial nerve, cranial nerve. Thank you so much, and yeah.